Hello everyone, and welcome to our virtual training program. In this module, we will be discussing neuroplasticity. Neuroplasticity is the ability of the brain to form and reorganize synaptic connections, especially in response to learning, experience, or following injury. Neuroplasticity has been described as the science of how the brain changes its structure and function in response to input. This definition includes two important points. First, the brain really can change in relation to structure and function, unlike all of our other organs. In fact, the brain is designed to grow new structures and create new pathways in the presence of an injury or of a challenge. Second, the phrase in response to input speaks to the fact that the brain doesn't change unless you challenge it. Any tasks that are familiar or easy do not challenge your brain, but activities that are difficult elicit changes in your brain's network that can stimulate neuroplasticity. Neuroplasticity provides us with a brain that can adapt not only to changes inflicted by damage, but also a brain that can adapt to all experiences we encounter. In other words, everyday activities or rehabilitation activities that help us learn new skills challenge the brain in such a way that begins the process of neuroplasticity. So, how does neuroplasticity work? Neuroplasticity can be seen as the process of rebuilding a bridge between disconnected streets or disconnected neurons, and participation in rehabilitative activities is the driving force in this process. Neuroplasticity can occur through four major processes. First, angiogenesis. This is the creation of new blood vessels within brain structures. In fact, after a brain injury, there can be decreased blood flow to brain structures when they can be most in need of oxygen for recovery. So, how do you stimulate angiogenesis? Research shows that one of the best ways to induce angiogenesis is through physical exercise, especially aerobic exercise. Examples include walking, swimming, dancing, cycling, and running. Second, synaptogenesis. This is the creation of new synapses, or connections, within the brain structures. The best way to stimulate this process is through engagement in cognitive exercises, such as doing puzzles, reading books, playing cards, going to lectures, or learning a new activity. Third, dendritic arborization. This is the growth of dendritic spines similar to the branches of a tree. Dendritic spines serve to gather information from other neurons and from which additional dendrites can grow for the purpose of gathering still more information. Similarly to synaptogenesis, this process can be stimulated by engaging in cognitive activities. The fourth and last process of neuroplasticity is neurogenesis. This is the creation of new brain cells, also called neurons. An article published by the Harvard School of Medicine shared that new scientific studies show that the brain continues to produce new cells as we age, even late into life, through the process of neurogenesis. The average brain contains about 100 billion brain cells, most of which are formed before birth. In the early stages of childhood, new brain cells continue to be made at a fast pace. Over the years, neurogenesis gradually declines, but the process never stops. This is especially true for an area of the brain called hippocampus, which is responsible for learning and storing new memories. So what stimulates neurogenesis? Studies show that aerobic exercises not only induce neurogenesis, but also increase the brain-derived neurotrophic factor. This is a protein in the brain, which is essential for overall nerve health, growth, and survival. It is like a fertilizer to help plant seeds grow. To best stimulate neurogenesis, the recommendation is engaging in 120 to 150 minutes of moderate intensity exercise per week. Overall, neuroplasticity can be summarized into 10 principles. 1. Use it or lose it. In other words, neural circuits not actively engaged in task performance for an extended period of time begin to degrade. This means that if we do not use an area of our brain for a prolonged time, we will lose the function that was previously stored there. 2. Use it and improve it. Training that drives a specific brain function can lead to enhancement in that function. An example of this is constraint-induced movement therapy, often used among stroke patients who may have lost use of a particular side of their body. This therapy entails restraining the non-affected side, such that the patient is compelled to use their affected limb as much as possible. 3. Specificity. You have to train your brain in very specific ways. Learning something new or retraining an old skill, rather than simply going through the motions of something you already know, helps increase connections in the brain. 4. Repetition matters. Repetition of a learned or relearned behavior is required for long-term changes in the brain. You need thousands of repetitions to master a skill. The more time you spend practicing, the better you perform. 5. Intensity matters. If you do something that doesn't challenge you, you won't see much of a difference. Intensity can be the number of times you do an exercise or how difficult it is. Try to find an intensity that is one step above your current level. 6. Time matters. If therapy targets changing, increasing, and strengthening the pathways in your brain, it should work anytime. However, there may be windows of time where progress happens at a faster rate. 7. Salience matters. Emotions can affect the strength of memory consolidation. If therapy is made interesting or important to you, such as engaging in your meaningful activities, you can more easily remember new skills or pieces of information. 8. Age matters. Our brains are the most flexible and adaptive when we are young, but connections in our brains can grow and change at any age. 9. Generalization. Learning in one situation, like therapy, can generalize to other situations, like social settings or the work environment. Similarly, training one specific skill can sometimes activate the pathways of nearby untrained items and improve those skills as well. And lastly, 10. Interference. Neuroplasticity means the brain is always learning, but it doesn't know the difference between good and bad. Maladaptive habits or practicing the wrong things might interfere with the positive changes you want to make. For example, oftentimes patients engage in compensatory behaviors for skill deficits, but these compensatory behaviors may not be the best way. With this, some of the challenge to learning the best way to regain a skills may involve unlearning some of the previously acquired behaviors. In summary, plasticity of the brain serves to support learning, and by utilizing these inherent capabilities, you can enhance recovery from a brain injury or from neurodegenerative conditions. Start applying knowledge of the principles of neuroplasticity to your everyday life. Thank you for your attention during this presentation. We hope the information was helpful to you.